Welcome to Doctors on Call. I'm Jenna Miller. An estimated 19 million American adults are living with major depression. People with major depressive disorders are less likely to respond to the first antidepressant they are prescribed. Victory Clinic is the first center in the Flint Hills region with 2 approved management options for treatment-resistant depression. Their purpose is to provide people with effective tools to achieve brain health, because to achieve optimal health, our brains must be healthy too. We'll tackle these issues and much more on Doctors on Call with our guests tonight, Doctors Kristie and Robert Clark.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.
Dr. Kristie Clark, the daughter of a disabled veteran, created Victory Clinic to bring integrated, innovative treatments to Junction City and the surrounding Flint Hills area of Kansas. Dr. Clark believes each of us have gifts and that a combination of mindful exercise paired with a creativity pursuit can lead to healing and health. Dr. Kristie, a graduate of Emory University School of Medicine, is a lifetime member of the Medical Honor Society Alpha Omega Alpha. Dr. Clark completed a residency in pediatrics at Children's Medical Center in Dallas, the University of Texas at Southwestern, and is board certified in pediatrics. Dr. Robert Clark, the son of a veteran, envisioned Victory Clinic. Dr. Clark's passion is creating difficult to treat conditions. Dr. Clark completed a Duke Visiting Fellowship in TMS and was the first Flint Hills physician to receive REMS certification to prescribe Spravato. Acknowledging the power of neuroplasticity, Dr. Clark believes brains can heal. Dr. Clark, a graduate of University of Texas at Southwestern, is board certified in family medicine. He completed a residency in family medicine at John Peter Smith Hospital. Dr. Robert is a leader in healthcare, having served as Chief Medical Officer of multiple health systems. He has expertise in caring for patients in the emergency department, hospital, clinic, and nursing home, as well as precepting healthcare students. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you guys so much for coming back. It's been a little while, but I'm glad you guys made your way back here.
Thank you, Jenna. It's good to be back.
We got a lot to talk about. So let's first start with a very simple question. What is depression?
I don't know if that's a simple question. I come across people all the time as a physician, and I don't realize they're depressed. And many times what we do, we give them a scale, a questionnaire to fill out. And many times I'm surprised to find out how stressed people are, how their confidence is low, their energy is low, they're not sleeping, they're anxious, they're worried. And that's kind of what depression is.
Definitely. And the most, there's people that just have coping skills and mask it. And so sometimes the happiest person you know can be depressed. I mean, look at Robin Williams. And so even comedians can be depressed. And so it's important to know it can happen to anybody. So I will say, if you're watching this and you feel like depression isn't something you deal with, please don't tune us out, because we all know somebody affected by it, and it might even be somebody we don't know is affected by it. And we all know somebody or somebody who knows somebody who's been affected by suicide. And so it's a very important discussion to have, because it might not be you, but it might be somebody you know and love that you might hear something tonight that might help save their life. So definitely stay tuned in. Depression's more than sadness. It really can shut all the physical systems in your body down, because your brain's an organ and it's basically in control of all your other body systems. And so that's something important to remember, is sometimes people aren't sad, they're not sleeping well, they're not eating.
So what are some of the signs of depression, especially for those people who are really good at masking it?
Well, I think as a casual observer, you may not initially notice it, but if you're experiencing it, if you take a moment to reflect, most people just report that they're stressed. And it's a cycle of stress that builds on stress, that builds on stress, that builds on anxiety, repeated thoughts, that's exhausting. And then you kind of lose that motivation, that ambition to plan, to do things that you enjoy. Relationships tend to suffer. And at first, maybe it's a bad day, and then it's a bad week, and then it's a bad month. And before you know it, the whole year is gone by, and you just aren't the person you used to be. And then at a certain point, family starts to know it, see it, your friends start to see it, and then hopefully you have that insight and you seek help, because this is a disease process. And like other diseases, you may not get better unless you have a plan to get better.
I think more people are seeking help than ever before, which is great. And it really seems like in our society, therapy is becoming more and more destigmatized, which is fantastic, because really everybody needs therapy, because therapy helps you be a better problem solver.
And what's going on? We had talked about, before the show a little bit, how before we went live, how suicide rates are at an all-time high. What's going on?
So your brain actually changes. A stressed brain is not like a healthy brain. So the nice thing about the technology we have now is we can do a functional MRI on someone. You can actually see someone's brain. You can see a healthy brain and you can see an unhealthy brain. So someone that's under constant stress, whether it be financial stress, health stress, relationship stress, your brain changes. And the part of your brain where you remember things, you plan things, you experience joy, actually shrinks. The part of your brain where you process information actually shrinks. So this is a real disease, and
it's anatomical.
Yeah, it's anatomical. You can see it on functional MRI, and you can't just break out of it by thinking happy thoughts. And so as that builds, people don't feel like they have a way out, and they feel overwhelmed. And unfortunately, sometimes we turn that into ourselves, and we look for a way out, and sometimes that's where we see self-harm and suicide. And that's obviously devastating, not only for that individual and the family and the community, but for generations to come.
Right. And it's not the individual's fault. For too long, we've really stigmatized mental illness and made it into a personal weakness. Somebody just needs to buck up. They need to work harder, think positive thoughts. But the brain's an organ, just like any other organ in our body. When someone has a heart attack, we don't blame them for not being stronger. When they have a stroke, we don't blame them for not being stronger. So it's just like that. I think the real thing is that medicines work some of the time. We've become heavily reliant on medications, and they don't work all the time. And in fact, study trials, statistically, sometimes 70% of the time, medicines don't work. And so what's really important, I think, is now that we have treatments that are not medication, is identify people that medications aren't working in, and then allow them to try these other treatment modalities that might actually cure their depression.
Sure. And what might be some signs that a medication is not working?
So we see this all the time, and you might know people that are on antidepressants. And so, the general feeling is if you have depression, you go see the doctor puts you on antidepressant, you get better. And that happens sometimes. It happens statistically about 30% of the time. So that means 70% of the time, you don't get better. However, that's where we tend to lose patients. 1 year later, 2 years later, 3 years later, they're still depressed, they're still taking the same medicine. So sometimes doctors and patients will get together and they'll do a change in medication. And that sometimes works. Sometimes we'll stack medications, and sometimes that works. But what we know from a scientific standpoint is if that first medicine doesn't work, the probability of the second medicine working diminishes. The third medicine that you try, the probability of you getting better diminishes. By the time you get to the fourth medicine, probably 10 to 15% chance that will actually help you.
Which isn't acceptable. We wouldn't do that in any other part of medicine. We'd never give somebody a medicine for blood pressure or high cholesterol and say there's only a 10% chance this is going to work, but try it.
Nonetheless, people get stuck doing the same thing over and over again where they take a medicine, take another medicine, take another medicine. A year goes by, 2 years go by, 10 years goes by, and you still are dealing with this horrible disease of depression and anxiety. So breaking that cycle is really what we're here to talk about.
Right. And I do want to reference our show we did back, episode 13 of season 13, where we talked about genetic testing to help people and their doctors choose the medicine that's best for them, especially in cases of depression. And so we do have tools to make better decisions with medicines, and we should use those tools. But at the same time, we acknowledge as physicians that medications don't always work.
And having said all that, tell me there's something new in the treatment of depression.
There is, and that's why we're here. We're so excited.
And I mean, there's been several big breakthroughs, but probably the biggest one in the market is something we've already known about. It's just in a different name. The name now is Spravato, S-ketamine, but previously the generic form was ketamine. But prior to 2013, the medical community really didn't understand that this could be used effectively and quickly to break the cycle of depression. So in 2019, FDA approved Spravato S-ketamine, which is a nasal spray. And the remarkable thing about this is that within 1 hour of your first treatment, there's a 40% response rate. That's to say, within 1 hour, you're better, almost half the people. Within 4 hours, over 50% of people are better after their first treatment. However, the response is very quick, but the durability, in other words, how long it lasts, is not very good. It tends to wear off after a few days. So right now is what we do is we give you 2 treatments a week for the first month, and then we taper down to 1 treatment a week for the second month, and then we continue to taper depending on how you're doing. But as time goes on, people tend to respond, or our real goal is what we call remission, and that's where you're completely cured of depression. And so as time goes on, the response rate does tend to improve. Maybe 50–60% of people are responders.
And these are people who've already failed multiple medications and probably have less than 10% chance of another medication try helping them.
Yeah,
so
compare
really
that
it's
to
pretty good.
Absolutely.
It's not good enough, but it's good.
Excellent.
Especially for the people it helps.
We want to talk more about this for sure, but right now we're going to go to the phone lines. We've got a caller waiting to ask you all a question. So go ahead with your question. Oh, no caller. I am sorry. We do not have a caller, actually, so we will keep on this subject. So let's talk about when a patient receives this as their prescription. What can they expect?
So we do it only in the office. So our clinic, for example, Victory Clinic, has a REMS certification with the DEA. It's a very strict program. Took a long time, probably 6 months for us to get through and achieve certification. And we can only give this medication in the clinic. And it requires a 2-hour observation period. And so it's not a medication that someone can do at home.
Insurance pays for this medicine. All insurance pays for it. Almost all insurance will pay for it if you have not responded appropriately to 2 adequate trials of traditional antidepressants.
Usually from 2 different classes, so 2 different types of depression medicine.
So, which almost everybody that comes to us has failed 5, 6, 7, 8 more medicines. So, but insurance pays for this if you've not responded to 2 prior medicines. And
another important thing to say is we really love our therapist. And so we really want people to continue in their therapy while they're on Spravato. And I think the most powerful thing is what patients have told me. And that is that when they're on Spravato, they're able to gain perspective on their issues and problems and past trauma. And they tell me that all of a sudden everything their therapist was telling them or things they've been reading or good advice they've gotten, all of a sudden clicks. It makes sense.
So as your brain starts to heal, the S-ketamine triggers this neuroplasticity, and you can actually see the regeneration of the brain. As your brain starts to heal, you start to get some ambition and motivation and planning. You want to get up and do the dishes, clean the house, things that before you would never had energy to do. So you patients experience not only feeling better, but an improved quality of life because they're actually doing things they want to be doing.
And if you want to see patients talk about it, because I think that's much more powerful than seeing doctors talk about it, but the people who experience it, we do have some testimonials on our website at victoryclinics.com, and there's patients on there talking about it. And I think they tell the story the best for how it helps them.
So Spravato is FDA approved for depression that has not responded to traditional selective serotonin reuptake inhibitors, norepinephrine reuptake inhibitors, traditional medicines. It also is FDA approved for suicide ideation. So someone that's acutely suicidal and having thoughts of self-harm, like we mentioned, this medicine has rapid onset so that if they were given the medicine, within an hour they're feeling better, and within that 4 hours many of them are no longer suicidal.
It's very exciting. I think over time we're going to start to see how we treat suicide ideation just really shift. You know, we have been putting people in the hospital, sometimes even against their will, for days at a time, and it's just very exciting that we're going to be able to, you know, hopefully one day soon in the future start giving people esketamine, and as long as they have a safety plan and we know they can safely go home with their family and be observed, possibly, you know, put firearms in a safe place for that duration of time until they're kind of out of the woods. This is just going to change everything for people with really severe mental illness.
Excellent. Okay, so if I'm getting the communication correct, there was a viewer who was wondering about psychedelic drugs.
Great question. So,
Absolutely.
So to a certain degree, you could put esketamine, ketamine into that category. So the analogy I like to give, and I hope this works, is picture a snow globe, and that's kind of your brain. And there's a mountain, and you're a snow skier, and you're skiing down the mountain, or you're skiing the same tracks every day, and you're getting in ruts. And the rut is anxiety, depression, that toxic negative self-talk. And then when you get a medicine like ketamine, esketamine, or the psychedelics for that matter, it's kind of like we shake up the snow globe and you get fresh powder snow. And it happens quickly. And then now you can ski those tracks anywhere. And that's where the talk therapy, your therapist comes in to make sense.
It lets the brain heal. The brain wants to heal. Humans are incredibly resilient. Throughout history, we've dealt with lots of trauma, and we have the ability to heal. And so it allows for that. It basically gives you a different perspective. But the thing about the psychedelics, I think it's important to say, is, you know, the esketamine is FDA approved, and we can get it prescribed from the pharmacy and get your insurance to pay for it. Psychedelics are still under clinical trials. I think they're coming out soon. I can't tell you when, but I think somewhere in the future, some of the psychedelics will become FDA approved, particularly for PTSD. There's a lot of hope there. And I think if somebody wants to hear more about it, there's a Huberman Lab podcast where they're interviewing one of the Stanford professors who's done a lot of research in TMS, which we'd like to talk about, and esketamine, and he's now doing a lot of research into psychedelics and finding it can be enormously helpful in PTSD. But again, you know, these are controlled substances, and a lot of it has to do with, even though they don't have addiction potential, back in the 60s and 70s, sometimes they were giving these medicines, but not under close supervision and not in a safe way. And so we're having to go back now and revise our protocols to
really what we're here to talk about
do it safely.
Are the treatments that are available now,
Definitely.
that are safe now. Those are things in the pipeline down the future.
Yeah, and we're keeping our eye out for those things.
Okay. All right, we've got Marilyn on the line, if I heard correctly, from Winfield. Hi, Marilyn. Go ahead with your question for our guest tonight.
Yes, I wanted to find out if the doctors that are on right now, if they are in Wichita, Kansas.
But again, you know, these are...
We're in Junction City, Kansas, but there are qualified doctors in Wichita that have access to these same therapies.
Yes. So if you live in Wichita, my advice would be to Google medical clinic, Spravato, and TMS, because you really want to find a center that does both, because depending on medical history, sometimes one course of treatment's better than the other. And so definitely Google, you know, Wichita clinics, TMS, and Spravato.
And then additionally, if you went to this Spravato website, there's a finder
Yes,
feature there where
that's
you put in
true.
your zip code and they'll tell you the closest treatment center.
Exactly. We're in Junction City, so that's a bit far for someone to come from.
But we'd love to see you.
Yeah.
And I do want to mention that quickly. You are new to Junction City, is that correct?
Yes, we are.
Yes.
Excellent. Okay, wonderful. Now, you said you wanted to touch on TMS, so
Yes.
let's talk about it.
So transcranial magnetic stimulation. We're talking about a magnet in your brain. Sounds kind of odd, right?
Or on your brain, not in your brain.
Right.
We're not doing that yet.
So magnets are painless, right? So you can take a magnet and put it on you and it doesn't hurt. But the relationship between magnetic energy and electricity is very close. And so you can trigger a synapse in the brain. In other words, you can trigger the brain to fire with an electrical impulse. So people probably have heard of shock therapy. Shock therapy is also extremely effective for treating depression.
But it
And
requires anesthesia
yes.
because
And
it's painful.
many mental health conditions can be treated with shock therapy very effectively. But there's some unwanted side effects with that. The magnet, however, is virtually painless, and we get most of the same benefits. So all it is a specially designed magnet that has about 2.5 Tesla. So think about the same power of an MRI, and it's delivered in a little ping. And the doctor, in this case myself, would do a mapping of your brain based on your diagnosis, and we would probably try to find the place in your brain that's kind of cooled off and under functioning from depression, and we would try to stimulate it. So it's a form of neurostimulation, and that part of the brain regenerates and grows, kind of like exercise. So if you exercise a muscle, it gets stronger, it gets better. So this is a brilliant way to regenerate the brain, to grow it healthier and feel better, and has virtually no side effects because there's not a medication. The problem with all these antidepressants is they have many side effects people can't tolerate or don't like. Weight gain is a big one, decreased libido, feeling a little bit of decreased cognition or fogginess
Some
in their
people
brain.
say they feel like a zombie on
Yeah.
depression
So
medicines. I hear that a lot.
the TMS machine is a great alternative. Again, your insurance pays for it. In most cases, insurance pays for it if you have not responded to 2 medications.
And patients who receive TMS tend to go in remission, complete remission.
Yes,
Over
so highly
90% of
effective.
them.
So yeah, that's the other thing is we're talking about once you've failed 2 medicines, remember the probability of a 3rd medicine working is probably 15%. Probably the 4th medicine working is probably 10%. Whereas we put you on the TMS machine, the probability of getting a remission, complete cure, is probably above 70%. And most recently, studies done at Stanford using advanced protocols, which we can do in our clinic as well, have achieved greater than 80% remission.
We can basically squeeze the 6-7 week protocol down into 1 week. So for a very busy professional who maybe wants to take a week off work and come in, we can get them through the whole protocol in a week.
Excellent. Well, we've got another caller. We just got a couple minutes left of the show, so we're going to go to the phone lines with Karen. Hi, Karen. Go ahead with your call or your question for Drs. Clark tonight.
Hi. I was wondering, does this Spravato have any effect on people that have OCD?
Great question. So right now the FDA indication for Spravato is depression that's non-responsive to medication, 2 medications for the most part, and suicide ideation. So probably it would help because it does reset the brain, but your insurance isn't going to pay for it. Now TMS, on the other hand, actually does have an FDA indication for obsessive compulsive disorder. So we can use these modalities to treat different mental health conditions. Tonight we're mostly talking about depression.
But I would say if somebody has severe OCD, it's definitely worth their time, if they haven't been responsive to medications, to seek out one of these centers that has TMS and Spravato and maybe ketamine as well, and try to see if there's any indication for any of these other treatments. I think that's a great question.
Okay, we just got a few seconds left. If a person feels like they may be depressed, that they see a loved one that they feel is depressed, what do they do?
Definitely get help. Definitely get help. And I think we all need to not be afraid to ask for help because none of us are perfect. And it's also important to say too that the suicide hotline number has changed. It's now 988, and that's for all of us to be able to call in, even somebody who has a loved one. And they also have a great website with lots of resources. But definitely don't be afraid to ask for help. Don't be afraid for someone to tell you they need help. We all need to, love each other and help each other navigate life.
Awesome. Well, thank you guys once again for coming back and joining us for our show tonight. That's Doctors Kristie and Robert Clark from Junction City. Our next Doctors on Call will be discussing family and sports medicine. You can email us questions for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Camco, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital. Experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.